Dr. Stein, there's lots of, I don't know if there's a lot, but there's definitely some questions about brushing. Some people say you should brush up and down in circle. Some people say you should brush in a 45-degree angle. Some actually say a 90-degree angle is better. Including flossing and stuff. Tell us, what is your feeling of a doable, reasonable, without spending 5 hours a day on dental hygiene? What should a patient do, and how should we go about it to brush his teeth?
The important thing is to clean to clean all the way around the tooth, and to stay away from the gums as much as possible. You want to brush the teeth where it meets the gum, but not the gum itself. So a 45-degree angle works for some people. I don't think there's one way that would work for everyone necessarily, but it's a combination. Usually the way we recommend is called the modified Bass technique, which is a combination of a back and forth and up and down, which some people will say to use a circular motion, which kind of incorporates both movements all in one. But the important thing is to clean both the tooth, all surfaces of the tooth, as well as the gums, the gum area, and then flossing as well. So the more the tooth is kept clean, and not injuring the gums, that's a big problem. We see a lot of people tend to be heavy-handed, and that's the reason to stay away from the gums, because people brush their gums. People do, meaning well, they try to brush, and they end up brushing away their gums, and they expose part of the tooth. You start developing sensitivity, and then there's more prone to decay. So it's important to just take your time, not to do it when you're rushed, and just go back and forth and around the tooth.
Okay. Now, and one should use a certain type of brushes, soft, hard, medium. What's the deal there?
Soft. Yeah, I wouldn't recommend anything more than a soft. The only time I'll make an exception is if somebody's if they've always used a very hard brush. To take someone directly from a hard brush to a soft brush, it's just too drastic of a change. So then in that case, I'll tell them just for a little while, kind of ease off into the soft brush, maybe use a medium for a little while and then go to the soft. But the goal is only soft, because even the soft can do damage by brushing too hard. So I wouldn't recommend anything harder than a soft brush. Even extra soft would be good for many people.
Interesting. And do you think that electric brushes have, an advantage?
I do. I think for many people it does get them to brush better, but I would make sure that it's one of a better quality electric brush, such as either Sonicare or Oral-B. Those would be the ones I would recommend the most. I don't like the battery-operated ones. I just find they don't have a safety mechanism. People, again, my concern is that people would brush too hard with that. At least with the higher-end brushes, they have a safety mechanism that if people apply too much pressure, it tells you that it backs away or gives you an indication that you're brushing too hard. Another benefit of using the electric brushes is it gets people to brush longer. With a manual brush, most people, I don't think the average person probably brushes for over a minute, and the recommended time would be about 2 minutes. So the electric brush gets you, it has a timer, and it tells you, so you know how long you should be brushing, and in so doing, you tend to brush a little bit better also.
Okay. Then maybe while you brush, there obviously is a little more movement in it because it rotates faster, so then you maybe get more mileage out of whatever minutes you do brush.
Right.
Do you?
Yes.
Okay.
Yeah,
now about flossing. Like when I floss, and I'm now not trying to say this is right, I'm actually trying to get a question answered. I actually pay a fair amount of attention. I think I pay more attention on actually kind of rubbing or massaging the upper gum. So basically I press it relatively hard up and go like this, or hard down and go like this. I'm not so sure I pay all that much attention of in between the teeth and go up and down. That looks always difficult to me because I go up, I fall out, I go, so I don't do too much of that. Tell us a little bit, of what we should pay attention when we floss.
I would think of the tooth as a circle, and when you go with the floss, first to hold your fingers close together so that you have good control of the floss. Then you go in between the teeth and wrap like a semicircle. Go halfway around the tooth into the gum line. So you want to go below the surface of the gums. And in each contact, you do half of one tooth and half of the other tooth, like a C shape and a reverse C on the other side. So that, and then you go to the next spot, you do the other half of the same tooth, and then half of the next tooth. So as you're doing it, you're encircling the tooth rather than just going down the middle of the tooth. Going down the middle, you're missing a good part of the tooth. And you're not, a lot of times people are afraid to go below the surface. The gums fit around the tooth almost like a cuff around, if you think of a sleeve, it fits, it's hard to get it in the camera, but around, so you want to get below the surface and not just, and that's the area that you want to, the goal is to clean. That's the area that's missed by the brush. So by cleaning in that area, if you can clean all the way around, that's the goal, to remove as much plaque as possible.
Okay. Now, what do you think about tongue brushing and tongue scrapers? I used to live about a couple of years in India, and almost everybody used one. I see very little here. Now, I personally brush my tongue and my gums with just a toothbrush. Again, tell us whether there's something which we should do, or is a tongue brusher better than the brush? Is it not better? Tell us.
It is important to brush the tongue because plaque builds up both on the same plaque that builds on the teeth also builds on the tongue. The tongue, if you look at it microscopically, has deep grooves and there's a lot of surface area that can collect plaque. That plaque contains different types of bacteria, and we want to get rid of as much plaque as possible. So it is important to keep both the teeth and the tongue clean. Whether you use the brush or a tongue scraper, they come in different forms. Some almost look like shaped like a razor with a handle, or there's some that are just more plastic. They're a little flimsier, but they work well. They have some notches on them just to be able to clean the surface of the tongue. I would say whichever you feel more comfortable. I personally find with a brush, when I try to brush my tongue, that I find it to be gagging, whereas a more especially designed tongue scraper, I find it easier to use. But if you're fine with the brush, that works. Whatever works for an individual. But I would recommend brushing the tongue as well.
Well, wonderful. Thanks, Dr. Stein.